Good afternoon, everyone. This is Dr. Val Arkush, Chair of the Montgomery County Board of Commissioners. Today is Wednesday, January the 20th. It is week 46 of the COVID pandemic here in Montgomery County. Welcome to our afternoon briefing. I'm joined today by my colleague, the Vice Chair of our Board of Commissioners, Ken Lawrence. Today, I will begin with the latest vaccine updates for Montgomery County. The vaccine situation is changing on a daily basis, and I want to ask our community's patience and understanding during this evolving situation. The Pennsylvania Department of Health changes to the vaccine eligibility announced yesterday dramatically expanded the eligible group of residents here in Montgomery County. However, there has been no comparable increase in the amount of vaccine that we are receiving. At the current rate that we are receiving vaccine, it could take us a year to vaccinate all of the individuals currently in the 1A category. Let me explain. Yesterday, the Pennsylvania Department of Health issued new guidelines for the Phase 1A group. Now, people ages 65 and older and people ages 16 to 64 with very specific underlying medical conditions that are known to be associated with severe cases of COVID-19 are now considered part of the 1A group. Montgomery County receives its vaccine from the Pennsylvania Department of Health, and thus we are required to comply with the newly released guidelines for Phase 1A. With these expanded definitions for the 1A group, we estimate approximately 250,000 additional people will qualify for vaccination in Montgomery County as part of the phase of 1A. Under these new guidelines, if you were in the 1B or 1C categories only because of your job, it will now be some number of months before we will have enough vaccine to vaccinate you. For now, anyone 65 and older and those aged 16 to 64 with one or two of those specific underlying medical conditions are encouraged to pre-register to receive the vaccine on our website at montgomery.org/COVID-19 and click on the vaccine information button at the top of the page. If you have already pre-registered on the site in the last days that site has been up, you do not need to do anything. We have you in the system. If it is now appropriate to move you to the 1A category, we will take care of that for you. I know this has been really confusing and very frustrating for a lot of people. I want you to know that there are a small number of pharmacies in the county that are starting to receive vaccine. We have a map with those locations on our website at montgomery.org/COVID-19. Additionally, a small number of doctors' offices are expecting to receive some doses of vaccine in the next few weeks, so you can also check with your doctor. But again, I don't want to create false expectations. Very few places have received vaccine, and they have received very few doses. So again, this is going to take a lot of patience. I also want to remind everyone that wherever you receive your first dose of vaccine, that is where you need to go to get your second dose. Finally, I want to clarify that Philadelphia is receiving their vaccine directly from the federal government and are not required to follow the Pennsylvania Department of Health directives. Therefore, you might hear about a different set of rules in Philadelphia, and this has also led to understandable confusion. Here in Montgomery County, we will continue to vaccinate individuals who live or work in the county that are in the 1A cohort. I do have to say that I'm very encouraged by the enthusiasm that so many people have to be vaccinated. And as I continue to ask for your patience, I want to share with you a graphic to give you a sense of where we are in this process. So I will walk through this graphic with you. On the upper left, you can see the doses received by the county. So this is just by the county health department. This does not count doses that have been received by our county hospitals. So as of yesterday, the county has received 17,000 first doses. We have administered, as of midday today, 10,603 of those doses, which leaves us with a little over 6,000. Actually, probably by the end of the day, it'll be about 6,000 doses left. We are continuing most days to do 1,000 doses per day. We do plan to do a little bit more than that, about 1,300 doses tomorrow and Friday. And it will be 4 days before we get our next vaccine shipment. So we will have, by next Tuesday, when we get our next shipment, about 1,700 doses left. So you can see we are giving them quickly. We have not wasted any doses, and we are trying to move this through as quickly as we can. So who is in 1A? What does that look like today? So I direct you to the bottom left corner box. So currently in the county, with this new expanded definition of 1A, we know from the census that we have over 151,000 people that are age 65 and older. We have estimated that we have in the group that is 16 to 64 with those specific high-risk conditions, about another 100,000 people. We still are not quite done with our healthcare personnel that were in the original 1A cohort. We believe we have about 1,500 to 2,000 of those individuals. So in total, we believe we have about 250,000 people remaining in the 1A cohort. In total across our county, and I'll direct you now to the box in the right corner, we have 26,405 individuals have received their first dose. So this is a combination of doses given by the county, doses given by hospitals in our county, and a few doses given by some pharmacies. So this is a little over 3% of our population. And then in terms of that second dose, we have collectively given 4,402 second doses. So again, less than 1% of our population. So you can see we have a really long way to go here. And we all have to hope that the supply of vaccine increases. Because as I said, you can do the math. At our current rate of receiving 5,000 doses a week, it will be an awfully long time just to get through the 1A group. I do, though, want to encourage people to pre-register now if you haven't already registered on our site. I do know that as of this morning, 80,000 people had pre-registered on our vaccine site, and that will be the quickest way to be notified if the county has vaccine available for you. For those of you that have registered on our site and haven't heard anything from us, please be patient. It's going very slowly because we have so little vaccine to give. But again, to get your name on that list, it's montcopa.org/COVID-19. And at the top of that page, click on the vaccine information button. Just one final reminder, appointments are required to receive the vaccine. We do not take any walk-up registrations. We will be requiring proof of age. And if you're under age 65, you will be asked to sign an attestation form that says that you attest. We won't ask you to share with us which underlying condition you have of the specific conditions that are included in this, but we will ask you to sign a form attesting to the fact that you do have one of those underlying conditions. And to read about those conditions, go to that same website, click on the vaccine information button, and we do have those conditions listed there. So you can determine whether or not you are eligible for this 1A cohort. All right, we'll move on to our regular update. Since the January 19th press release, we have 195 new cases of COVID-19 reported in Montgomery County, bringing us to a total of 40,064 cases. all a result of a positive test for the virus, not from the antibody test. Today, 8 of these were from long-term care facilities and 187 were from the community. 190 of these tests are from the last 7 days or less, and only 5 tests are from 8 to 14 days ago. These positive individuals are from 52 municipalities. As you know, all 62 municipalities are home to individuals with COVID-19. Today's individuals range in age from 6 months to 90 years old, and you can check our county maps at montcopa.org/COVID-19 for updated geographic information. Today, we had 101 females and 94 males. I am very pleased to share that we had no additional Montgomery County residents who lost their life to COVID-19, which leaves us at a total of 1,099 deaths confirmed positive from COVID-19. Overall, there have been 570 females, 529 males, and they have ranged in age from 25 years old to 106. I do want to note today that as a country, we've passed the 400,000 mark in terms of number of lives lost to this disease. And I share that number today because, just as a reminder, in the entirety of World War II, just over 400,000 Americans lost their life fighting that war. So now, just in this single year, we have lost as many lives to COVID-19 as we lost in the entirety of World War II. There are no new updates from the Montgomery County Correctional Facility, no new positive inmates at the facility, and everyone who has previously tested positive is stable. So we have some good news on our positivity rate. Our positivity rate has ticked down again this week, so we are really happy about that. You can actually see on our chart now that it is starting to go down. As a reminder, the orange lines in the background are the number of daily PCR tests performed in the county, and then the blue line is the 14-day average positivity rate. So today we are down to 9.5%, or I'm sorry, as of Friday, January the 15th, we're down to 9.5%, compared with 10.45% as of Friday, January the 8th. I want to note that December the 4th was the last time that our positivity rate was under 10%. As a reminder, we're trying to get down below 5%. That is considered suppression of the virus. And our next graph shows our daily positivity rates from January 2nd to January 15th. It does show that we're still above 5% all 14 of those days, but you can see we're starting to definitely get a little bit closer. So this is really very good news. In terms of our hospital data, our hospitals continue to remain pretty full and busy, but this number is also moving in the right direction. Not surprisingly, these things do travel together. Today, we have 324 individuals with COVID-19 hospitalized in a Montgomery County hospital. This is decreased from 380 last week. 12% or 38 of these individuals are requiring a ventilator. As I said, our hospitals do remain quite busy. And to put this in some context, on October the 1st, there were 24 patients hospitalized, 24 total patients hospitalized in Montgomery County hospitals. And today we are at 324. So this is great progress. We're going in the right direction, but please don't think that you can let up in any way because our hospitals remain quite busy. In terms of testing, for the 14-day period that ended January the 15th, 58,784 Montgomery County residents were tested for COVID-19, which is an increase of 2,824 people tested compared with the 14-day period ending January 8th. So this is great. You know how strongly I support robust testing. You should get tested if you need or want to be tested. So let's move to our date tested graph. As a reminder, these gray bars are the number of positive cases on any given day. The darker red line is the 7-day average of cases that includes the community, long-term care facilities, and any congregate facilities. And the pink is the 14-day average of those total cases. The dark blue line is the 7-day average of cases that are from the community only. And the light blue is the 14-day average of community-only cases. And then down at the bottom, the orange and yellow lines are 7 and 14-day averages from our long-term care facilities. So next we'll zoom into the last 10 weeks. And you can get a better sense of this downward trend that we are very happily experiencing. You can see that we did not get nearly the surge that we saw after Halloween and Thanksgiving. So again, wonderful news for our county, and we do start to see these lines trending downward. So let's keep up that good work. So as I mentioned, we do have continue to have great availability of testing. It's very easy to get an appointment to be tested, and I, as always, urge anyone who wants or needs to be tested to get tested. Our sites are open Monday through Friday with varying hours each day. This Saturday, January the 23rd, the Norristown site will be open from 9 a.m. to 1 p.m. Registration for the Norristown site for Saturday hours this Saturday will open online at 7 p.m. Friday evening, January the 22nd. There will not be any phone registration for the Saturday testing appointments in Norristown. To register for a test any day of the week, to register any regular Monday through Friday testing day, you can go online to moncopa.org/COVID-19 and click on the green County Testing Information button. And that's where you would go to register Friday evening for the Norristown site on Saturday. Monday through Friday, those appointments open up at 7 a.m. on the day of testing. You can also call by phone to 610-970-2937 for all of the sites starting at 8:30 a.m. the day that you would like to be tested. And again, just a reminder, we're not able to book ahead for testing. So we do continue to remain in a serious and continually evolving situation. While our cases are trending down, we have averaged 303 cases per day for the last 7 days. So this is still a substantial number of cases and is associated with a substantial number of hospitalizations. While we await the arrival of enough vaccine in our community to vaccinate everyone who would like to be vaccinated, we must continue to wear our masks, wash our hands, and watch our distance from people that are not our household members. I have 2 announcements. The first is that we will be holding a vaccine town hall tomorrow evening. Tomorrow night at 7, myself and Commissioner Lawrence are joining the Black Doctors COVID-19 Consortium and area faith leaders for an interactive virtual town hall entitled Facts, Not Fear, COVID-19 Vaccines and the Black Community. As we distribute the COVID-19 vaccine, we remain concerned about the lack of trust and the hesitancy about taking the vaccine across Black communities. This is particularly important because we know Black people are 2 to 3 times more likely to die from the coronavirus. This is due to disparities in healthcare, workplace exposures, and certain underlying health conditions. During the event, we will share the latest COVID-19 vaccination research, discuss vaccine availability and distribution, and answer your questions and concerns. Registration is free. Everyone is welcome to attend. And we also encourage you to pre-register to attend this town hall because then you'll get some reminders about it. So to register, visit moncopa.org/town hall. Again, that's moncopa.org/town hall. And my second announcement is that we are changing the time of these Wednesday briefings slightly. So beginning next Wednesday, January the 27th, and going forward, These briefings will begin at 1:30 p.m. Let me just repeat that. Starting next Wednesday, the 27th, these briefings will begin at 1:30 p.m. Please note the time change. And with that, I am happy to take questions.
We'll start our questions with Jim Melward from KYW.
I'll start with a general one. We can hear the frustration in your voice over this phase 1A. Just what are the major issues that you're concerned about?
Well, I'm concerned about a couple of things. First of all, the announcement yesterday created a great deal of excitement and enthusiasm among a lot of people who are 65 and older, or who are younger than 65 and have certain health conditions. It created an expectation that they could get vaccinated in the near future. And unfortunately, the other half of the message, although it was stated, was not made very clear, that we don't have any vaccine. We don't have anywhere close to the amount of vaccine necessary to vaccinate all of these people. And so I know it's incredibly disappointing and frustrating, but we have a lot of people whose expectation was they would be able to be vaccinated soon. And unfortunately, I'm sorry to say, that is just not the case. The second complication that this has created is that there were a number of people who work in very frontline, essential work in our community. Includes teachers, grocery store workers, our SEPTA public transportation drivers, people who work in other critical infrastructure that keep the lights on and the water running. All of those folks were in the queue in the relatively near future to be vaccinated because of their job status and the fact that their jobs expose them in a very public way to the risk of getting COVID-19, and that their jobs are also critical to the full functioning of our community. So those individuals are now potentially, depending upon the availability of vaccine, literally months from being vaccinated at this point. So unless something dramatic happens with the supply of vaccine, and I very much hope under this new administration that it does, but I have no certainty about that as of yet. But unless that supply increases, many of the economic challenges that we were also facing will continue because a lot of these essential workers will not be able to get vaccine. And then finally, I have to point out there's an issue of equity here. Many of our frontline, most essential workers are from communities of color. And it was a top priority for me to be able to make sure that we made a vaccine available to those individuals if they wanted to be vaccinated. And again, now that is put off for some as yet unknown period of time, but it will be a considerable amount of time at our current rate of receiving vaccine.
Throughout the pandemic, you've said that you've been in communication with the State Department of Health. Did they discuss this change with the counties or with you at all?
They did not. There was no discussion, at least with me. There was no seeking of my thoughts about this or any advanced warning that this change was coming.
And I asked Department of Health this question yesterday, and frankly, the answer wasn't very strong. But kind of what you just talked about, doesn't this make it, if you don't have vaccine and you expand phase 1A, doesn't it make it more difficult to get to the people you need to get to? It doesn't seem to make sense to expand a group when you don't have the vaccine. It wasn't a shortage of willing people to get the vaccine. It was a shortage of vaccine.
Correct. So the expansion of this criteria has not changed that basic fact that we have way more people who want vaccine than we have vaccine. And so what this expansion of criteria has done is create expectations among individuals who really want to be vaccinated. And look, I understand that. I'm hearing from seniors all across this county, and I understand how much they want to be vaccinated. But we don't have nearly enough vaccine. And so it's just taken an already high stakes, complicated situation and made it worse.
I have some more questions, but I'll pass it off and let some others. I know we have a lot of reporters on here, so.
Thanks, Jim. Next, we'll go to Charlie Rextis from the Delaware Valley Journal.
Hi, thanks so much for talking to us today. I think my only question at the moment is, do you have hope that more vaccines are going to be approved by the FDA soon? I know Dr. Levine was saying a few weeks back that she was hopeful that the Johnson & Johnson would be approved soon. What are your thoughts on that in order for Montgomery County to get more vaccines?
I do have hope that additional vaccine will be approved, but let me just give you a sense of that timeline. So it is my understanding from what I've read in the newspapers that Johnson & Johnson is very close to submitting their data to the Food and Drug Administration for approval of their vaccine under what's called emergency use authorization, and that could happen hopefully sometime in early February. So let's say that it does. It's been taking the FDA about a month to review the applications, which is quite, fast, but they're prepared, they're geared up. They want to move these things, do their thorough review, but get that done as quickly as possible. So let's say that maybe best case scenario, if everything checks out, that the vaccine would be approved in early March, and then they could start shipping. So I sure hope that happens. That vaccine in particular is a single dose vaccine, so that would be helpful as well. But I think in the rosiest scenario, we're talking sometime in March before we would start to see that vaccine.
So in more non-rosiest ideas, do you think that it's going to stick to the timeline that you're predicting right now for a while longer?
I would assume so. I do know that the incoming Biden administration has made some statements about ramping up production, perhaps using the Defense Procurement Act to bring additional manufacturing facilities online to make vaccine of the currently approved ones. I have no information other than what I've read in the papers. But if any of that is true and they are able to increase vaccine production, then hopefully we would see some of that. But at the current rate, the county's getting 5,000 doses. We keep asking for more, and we've gotten 5,000 doses this week. We did get the one little ray of good news here is we did get a allocation of second doses, which we had been promised all along that we would get. And so this would have been the first week that we would have needed to receive second doses. And we did receive the amount of second doses that we requested. So that was good. So those individuals will be able to get their second dose. But in terms of the first doses, we need tens of thousands more doses, right? If we got 6,000 next week, it's a drop in the bucket. We've got 250,000 people probably in that 1A category. So we need more vaccine.
Thank you so much.
Thanks, Charlie. Next, we'll go to Jeff Cole from Fox 29. Looks like Jeff just dropped off, so we will see if he can get connected here. In the meantime, we'll go to Deanna Durante from NBC 10.
Hello. So I just want to touch upon a couple of things that you had brought up. You said it could be a year to get the vaccine. You're talking about just to the people in the group 1A.
So if
timeline, I just want to clarify, if you continue on this current path, you're saying that it will take a year to vaccinate that 250,000 population of 1A.
Yeah, this one's a simple math problem. So we've been getting 5,000 doses a week last week and this week. So if we continue to get only 5,000 doses a week, it's 50 weeks to get to 250,000 people.
Okay. Yeah. I just wanted to double check we weren't talking about everybody, because I myself get a lot of phone calls on how can I get the vaccine, and especially yesterday, I fielded phone calls from people who said, wait, the health department says this, and now I can't get the vaccine, and how do I go about it? And can you ask them tomorrow? And you already went down that road. So the other thing is the equity part. You talk about the people who need it the most, who are working on the front line. And I believe I asked you about this last week as well. When it comes to this supply and demand and the ability for people to sit in front of computers and wait for that reservation slot to open and keep registering, you're basically giving it to, or the people that are getting it in this luck of the draw, are the people who have the time, the energy, and the technology to sit there and try and go after this vaccine. Isn't that right?
That is correct. I am not happy about this situation. I was comfortable with the original vaccine allocation plan because I thought it did a good job of balancing, and it's always a balancing act, older people who we know are much more likely to die from the coronavirus, with also creating access to the people who are most likely to get the coronavirus. And when it comes to communities of color, across ages, individuals, particularly Black individuals, are more likely to die from the coronavirus. And in many cases, the rates are higher in those communities because individuals are working in jobs that put them in a public-facing type situation. So the inequities here are deeply and profoundly concerning to me. And we took a plan that I thought did a good job of balancing the equity issues, and now have created a plan that can absolutely create disparities at a time when we should not be doing that. I have a feeling Commissioner Lawrence may want to say something. I see him moving toward his camera. So,
yeah, I just want to add that we've redefined essential workers during this pandemic. And I just think it's tremendously unfair that grocery store employees who have been working throughout this will not be vaccinated now. SEPTA, we need SEPTA to run to get our healthcare workers and other essential workers there. They will not be vaccinated now. It just does not make sense to me. That people who might be able to stay home and to your point can monitor for those appointments will be getting it now. We need a lot more vaccine. Hopefully we will get it ramped up. But for a lot of people who have been working throughout this pandemic that they can't stay home, they're going to be delayed now, and it's not right.
If Jeff's back on, I can defer to him if he's got some questions. I have a couple more, but I can keep this moving if he has some. Or Todd, if you want to go to the next person.
Okay, thanks, Dan. We'll come back to you in round two. We'll go to Carl Hessler from the Pottstown Mercury.
Good afternoon, Commissioner. When you're talking, I need just as a clarification. When you're talking 5,000 doses of the vaccine, you're talking about just the number of doses that came to the county health department, correct?
that's correct. So our hospitals are getting some other doses. They're not clear how many they're getting from week to week. They are still working on vaccinating their own employees, but they are also working with the county to help vaccinate into the community. So we're working together with a very cooperative approach, trying to make sure that we get every dose of vaccine that comes into this county, no matter who it comes into, out there and into somebody's arm. But the 5,000 are just to our health department.
Okay, so if somebody wants to get a vaccine at a hospital, how do they pre-register for that? Say they don't want to go through your county health department or clinic to get it. How do they do that?
Each hospital is in a little bit different situation. And so unfortunately, there's not an easy answer to that. They would have to check with whichever hospital they were interested in. The hospitals, by and large, do not have any kind of community clinics open. They are still vaccinating their own employees. They have been helping the county, working together with the county to vaccinate a number of first responders. And then in some cases, particularly if they think that they might have some doses go unused, they have reached out to patients that are in their system and invited them to come in to get vaccinated. So it's not, they're not like we are, where we have a system and we're doing mass vaccinations. For the hospitals, it's much more of a, maybe small numbers here and there.
Okay. And in light, and I know I've asked this question, I think the last 2 weeks, but in light of the situation now where you're saying there just isn't enough vaccine, you really are not going to be able to open another clinic site anytime soon, correct?
Well, Carl, I think what we will do is as we get closer to having quite a few people needing to come back to the community college for their second dose, that we will open up another site so that we can continue to take first dose appointments. So it's a bit of a two-pronged plan. We'll increase the capacity at the community college by some number to accommodate for some of the second, make sure we can get all of the second doses through, but still be able to take some first doses, and then open up another site for the brand new first doses.
Okay.
That's
All right.
that's our short-term plan. And then we're working on even perhaps bigger site that could be open for, the next year or however long it takes.
And are you aware of any plans by the state officials or federal officials to come in and hold some mass vaccination sites like you're seeing in some other parts of the country where they're having vaccination sites at stadiums and places like that? Is there any talk about doing that in our region?
Not that I'm aware of.
Okay. That's all I had today. Thanks for taking my questions.
Yep.
We'll move on to our second round of questions, starting with Jim Melward from KYW.
I don't mean to hold things up, but is Jeff back on? I don't see
He
him.
has not rejoined as of now, Jim.
Okay. So correct me if I'm wrong, but it seems that this change came from Health and Human Services Secretary Azar as he was kind of going out the door. Is that correct? And if so, could it change back, or would you expect a possible change back to the previous 1B, 1A, 1B, 1C, or is the toothpaste out of the tube?
I've been told that Secretary Azar's comments influenced this plan, but I don't have any direct knowledge of the decision-making that went into this plan. It's funny, I used that very analogy this morning that the toothpaste is out of the tube on the floor at this point, and I don't know if it could be walked back per se. I do think that parallel tracks could be established for essential workers, and so we would have the ability to take whatever vaccine that we have and share it, some for people over 65 and with these serious underlying conditions, and some for people that are working on these extremely important public-facing jobs.
You mentioned the economic impact with grocery store and other workers. And did you mention teachers and what this means for education?
I did mention teachers. And again, another area I'm extremely concerned about. Teachers who meet the age criteria or the underlying medical condition criteria would be able to get vaccinated, as would school bus drivers and custodians and others that work at schools. But in terms of vaccinating all of our teachers, which had been our plan, we don't have the ability to do that right now.
And what about first responders that weren't 1A, like cops and fire? Are they able to get it, or are they at the back of the line now?
Well, they are getting it. That was part of our, both in our Department of Public Safety as well as some of our hospital partners. We did start reaching out to the police and fire who were in 1B, sort of very near the top. And in Montgomery County, we have a situation where our police are dispatched to virtually every single medical call. And when I had our team run the data, 35 to 40% of the time, the police get there first. and they might begin CPR, they might begin Narcan or give Narcan or start other basic first aid procedures. And so we really think of our police and to some extent our firefighters as well, because they do respond to some of these calls as well, as almost as much of a medical responder as our paramedics and EMTs. So we have started to vaccinate them, and we should be largely through those groups by the end of this week.
And is the county tied to the Pennsylvania Department of Health? Are you forced to follow their policies, or could you kind of adjust them as you saw fit?
Well, they give us our vaccine, and so I think we have been told we are to follow their policies, and I think if we deviated greatly, that potentially there could be a problem there. For instance, I got specific permission from the Department of Health to proceed with vaccinating our police and fire. I showed them the data from our county, and they agreed that they were effectively medical responders. And so we did this in the light of day with their permission to go ahead and vaccinate them.
Thanks, Todd.
Thanks, Jim. Next, we'll go to Deanna Durante. And if any of our other reporters have follow-up questions, please let me know via the chat in WebEx or by raising your hand. Go ahead, Deanna.
Deanna, are you muted?
Can you hear me?
Yes, now we can.
Okay, now I can't see you, but I can hear you. I was going to say you can finish taking a drink of your water. I can wait.
I'm good.
I want to follow up on the schools because some school districts, and including in a parents group that I'm in this morning, they are sending petitions to superintendents, given the Department of Health and the state statements last week before, encouraging students, K through 5 to get back into the school fuller time. I think it was mainly did at schools that are virtual, but are still, the schools that are still 100% virtual. But anyway, so we're seeing that push again to get kids back into the classroom. Has anything changed since August that would make this easier for school systems to get more kids in the classroom?
Well, we certainly understand that push, and particularly for the elementary students who, it's just tough. It's tough to be at home virtual 100%. So we continue to work very closely with the schools. Nothing has changed about the virus per se, but what has changed is that we've got a very good communication and infrastructure at the schools. Each school district has a pandemic coordinator that is working directly with our Office of Public Health, so there's great communication there. As you might remember, I think I talked about this last week, we've offered antigen testing to the schools for regular testing of the teachers, and also to have antigen testing on site so that if anyone becomes ill during the day and has symptoms of COVID-19, they can get an antigen test immediately. And then if it's positive, we have a mechanism in place for them to get a confirmatory PCR test. So the goal with that testing was to hopefully help teachers feel more safe, know that they're being tested. Many teachers are worried about bringing something home to a family member who might have a serious underlying condition that puts them at very high risk from the coronavirus. So we've got those pieces in place. One of the areas where we're continuing to do contact tracing, even with these very high numbers of cases per day, is in the 18 and under group in an effort to help support our schools. So we put those infrastructure pieces into place for our schools. We do have a number of our schools that have some number of students back in the buildings. We do still have some school districts that have not done that. And again, it is on the school boards to make those decisions. While the Office of Public Health is able to close a school in a public health emergency, we have no ability to require a school to open.
Okay, I'll call you back. Okay, and so then again, this plan to change the vaccine, at least at this point, again, impacts how quickly you can vaccinate teachers.
It definitely does. And so again, anyone who's in that older cohort or has one of those underlying medical conditions will vaccinate. But and oh, by the way, let me just add, there's one group I forgot to add. We have vaccinated the school nurses, or in the process of that. And we've also been vaccinating the special ed teachers and their aides who do very hands-on work with students with certain special needs. So they are being vaccinated. But when it comes to the general teacher population, which we had been planning to vaccinate in the relatively near future, our hands at the moment are tied on that.
Thank you very much.
Yeah.
Thanks, Deanna. We'll go back to Jim Melward for one final follow-up question.
Yeah, really quick. We just got so caught up on the vaccine. Looking at the numbers, positivity rate, cases, what are your thoughts on concerns over the holidays and what we're seeing? Have you seen the spike that you were worried about? Does it seem like we're out of the woods on that?
Yeah, happily, we saw a very small spike after the Hanukkah, Christmas, New Year's holidays. So thank you, everybody who stayed home instead of celebrating those holidays with people outside of your house. We saw a little bump, but it wasn't too bad. Nothing compared to what we saw after Thanksgiving and Halloween. So that's all great news. It is still cold out. And in fact, I think we have a code blue issued for tonight. And so we're not going to see a lot of people eating outdoors or things like that could really help reduce the risk. So I don't anticipate that our numbers are going to go down a whole lot lower. I mean, I hope they do, but I imagine we'll still be in the, couple hundred cases a day range for a while now. What we have our eye on with a great deal of concern is these more contagious variants. And so far, I don't want to cause any panic. So far, we have not seen evidence that we are experiencing any kind of increasing or more rapid spread here in our community, but we are keeping a very close, watchful eye for that. That could really be problematic. If you see what's happening in Britain and also in Los Angeles County, it's really extremely contagious. And so even though it doesn't make people any more sick, there's just the more people that have the virus, the more people, that same percentage of people will be hospitalized. And so the more people with the virus, the more people that will be hospitalized. And of course, the more people will die. So we hope it stays away from here. But the things that you can do to protect yourself from it are the same things we've been asking you to do this entire time, which is keep that mask on, keep those hands clean, and watch your distance. It will protect you from the more contagious variant as well.
Thanks.
Mm-hmm.
That concludes our questions for today.
All right. Well, thank you, everyone. I hope you'll join us for our town hall tomorrow evening. And then just one more reminder, we will see you at 1:30 next Wednesday. Thank you.